Our immune system is like a highly trained army, always on patrol to protect us from bacteria, viruses, and other invaders that threaten our health. It works around the clock, scanning for anything that doesn't belong and launching a defense when needed. Usually, this system is so efficient that we go about our daily lives, walking in the park, spending time with loved ones, without ever realizing the battles being fought inside us. It quietly keeps us healthy, distinguishing between what's part of us and what's a potential threat. But sometimes, this complex system gets confused. Instead of protecting us, it turns against us, a condition known as autoimmune disease. This can be a frightening and puzzling experience for patients and their families. In autoimmune diseases, the immune system mistakenly attacks the body's own healthy tissues, as if they were dangerous invaders. This misdirected attack can happen in almost any part of the body, leading to a wide range of symptoms. This friendly fire causes inflammation and damage, which can result in pain, swelling, and long-term complications. Over time, these attacks can lead to chronic conditions that require ongoing care and attention. Inflammatory myopathies are a group of these autoimmune diseases where the immune system specifically targets the muscles. This can make even simple movements feel exhausting or painful. Instead of defending, immune cells invade healthy muscle tissue, causing ongoing inflammation and progressive muscle weakness. Everyday actions like lifting objects or climbing stairs can become major challenges. Over time, this relentless attack weakens muscles further, making daily tasks increasingly difficult. People may find themselves needing help with activities they once did with ease. Polymyositis is one such disease, an internal conflict that isn't caused by infection or injury, but by the body's own defenses going awry. It can affect people of any age, though it's more common in adults. The battleground is the muscles that let us move, work, and enjoy our lives. When these muscles are under attack, it can impact independence and overall well-being. Understanding how and why this happens is the first step in fighting back. With the right approach, we can manage the immune response, protect muscle strength, and help patients regain control over their lives. That's the foundation for effective treatment and a better quality of life, helping people move forward with hope and resilience. Polymyositis means inflammation of many muscles. This condition is part of a group of diseases known as inflammatory myopathies, which are characterized by chronic muscle inflammation and weakness. Unlike a pulled muscle, it's a systemic problem, affecting muscles on both sides of the body. This means that the inflammation and weakness are not localized to one area, but are widespread, impacting overall muscle function. The main targets are the proximal muscles, hips, thighs, shoulders, upper arms and neck. These muscles are crucial for everyday activities and maintaining posture. These muscles power major movements like standing, climbing stairs, and lifting. When these muscles are affected, even simple tasks can become challenging. When inflamed, they weaken, making daily activities harder. This can significantly impact a person's independence and quality of life. The process is gradual, often unfolding over weeks or months. This slow progression can make it difficult to pinpoint the onset of the disease. Early signs, like struggling to rise from a chair or tiring quickly, are easy to dismiss as aging or fatigue. However, these symptoms should not be ignored. But these are the first clues of polymyositis. Recognizing these early signs can lead to a quicker diagnosis and better management of the condition. It primarily affects skeletal muscles, but in rare cases, swallowing or breathing muscles can be involved. This can lead to additional complications and requires careful monitoring. That's why a thorough medical evaluation is crucial. Comprehensive testing can help identify the extent of muscle involvement and guide treatment. Understanding the widespread, progressive nature of this inflammation explains the pattern of symptoms. This knowledge is essential for developing an effective treatment plan. Recognizing these signs early can make a big difference. Early diagnosis and intervention can slow the progression of the disease. Early intervention helps preserve muscle function and quality of life. With proper management, individuals with polymyositis can maintain a good level of independence and well-being. The main symptom of polymyositis is muscle weakness, usually symmetrical and most noticeable in the hips, thighs, shoulders, and upper arms. Everyday tasks, like climbing stairs or lifting groceries, become challenging. This weakness develops gradually and doesn't improve with rest. Muscle pain, or tenderness, is also common, even without strenuous activity. Profound fatigue often accompanies the weakness, going beyond normal tiredness. Some people have trouble swallowing if throat muscles are affected, a symptom needing prompt medical attention. Other signs can include unexplained weight loss, low-grade fever, and muscle atrophy as the disease progresses. Occasionally, joint pain and stiffness may occur. Recognizing this collection of symptoms is key to seeking help. Early diagnosis leads to better outcomes. Don't ignore persistent, unexplained muscle weakness. Timely action can change the course of the disease. What causes polymyositis? This is a question that puzzles both patients and doctors alike, and the answer is more complex than it might seem at first. The exact answer remains unknown. Despite years of research, scientists have yet to pinpoint a single cause. What we do know is that the immune system, which normally protects us from infections, mistakenly attacks healthy muscle tissue in polymyositis. This ongoing attack leads to inflammation and muscle weakness, but the initial trigger is still a mystery. Genetics play a role. Some people have genes that make them more susceptible. These genetic factors may influence how the immune system functions or responds to certain environmental cues. But having these genes doesn't guarantee you'll get the disease. Many people with these genetic markers never develop polymyositis, so genes are only part of the story. Environmental triggers, like certain infections or toxins, may set off the immune response in those at risk. Viral infections, exposure to certain chemicals, or even some medications have been linked as possible triggers, but no single factor has been proven to cause polymyositis in everyone. The immune system might confuse muscle cells with invaders after an infection, leading to a case of mistaken identity that causes the body to attack itself. It's important to know what doesn't cause polymyositis. It's not contagious, not caused by injury, and not due to lifestyle choices. You can't prevent it by changing your diet or exercise routine, and it's not anyone's fault. You can't catch it or give it to someone else. There's no need to avoid people with polymyositis, and they don't pose a risk to others. Exercise under medical guidance is actually helpful for management. Staying active can help maintain muscle strength and improve quality of life, as long as it's done safely. Understanding the real causes helps reduce stigma and focus on effective treatment. It encourages people to seek help and follow their treatment plans without shame or guilt. Dispelling myths is crucial for support and recovery. When people know the facts, they can better support loved ones and advocate for themselves. The focus should be on managing the immune response, not blaming oneself. With the right information and support, people with polymyositis can lead fulfilling lives. Diagnosing polymyositis is challenging because its symptoms mimic other conditions. There's no single test. Doctors act like detectives, piecing together clues. Diagnosis starts with a detailed medical history and physical exam, focusing on muscle weakness patterns. Blood tests check for elevated muscle enzymes like creatine kinase, signaling muscle damage. Autoantibody tests can confirm the autoimmune nature. Electromyography, EMG, and nerve conduction studies assess muscle and nerve function. The most definitive test is a muscle biopsy, revealing immune cells invading muscle fibers. This combination of tests rules out other causes and confirms the diagnosis. Early, accurate diagnosis is essential for starting treatment. The sooner treatment begins, the better the outcome. There's no cure for polymyositis, but treatment can restore strength and function. The main goal is to suppress the immune attack and reduce inflammation. Corticosteroids like prednisone are the first line, quickly controlling inflammation. As symptoms improve, doctors taper the dose to minimize side effects. Immunosuppressants like methotrexate or azathioprine are often added for long-term control. In severe cases, intravenous immunoglobulin, IVIG, may be used to modulate the immune system. Finding the right treatment plan is a team effort between patient and doctor. Regular follow-ups and blood tests monitor progress and side effects. The aim is remission, keeping the disease inactive and preserving muscle function. With the right approach, most people regain significant strength and quality of life. Managing polymyositis goes beyond medication. It's about daily habits and support. Balancing activity with rest is crucial. Pushing too hard can trigger flares. Break tasks into smaller steps and schedule regular rest periods. Simple home modifications like shower chairs or raised seats can make life easier. Assistive devices help conserve energy and maintain independence. Emotional support matters too. Connect with support groups or talk to a counselor. Sharing experiences with others facing similar challenges can be empowering. Keep a journal of symptoms and side effects to help your healthcare team. Build a partnership with your doctors, therapists, and loved ones. Be proactive, ask questions, and participate in treatment decisions. Combining medical care, lifestyle adjustments, and support leads to better outcomes. You can live a full, meaningful life with the right strategies. Once inflammation is controlled, therapy is key to recovery. Physical therapists design gentle, tailored exercise programs to rebuild strength and mobility. They focus on stretching and gradual strengthening, targeting the most affected muscles. The goal is to regain function without triggering flares. Occupational therapists help you adapt daily activities, like dressing, cooking, or working. They teach energy-saving techniques and recommend adaptive equipment. Therapy is about education and empowerment, not just exercise. Setting realistic goals and celebrating progress keeps you motivated. Active participation in therapy translates medical gains into real-world improvements. This teamwork maximizes your independence and quality of life. Therapy is a proactive step toward regaining control. Polymyositis is serious, but it's manageable with early action and the right care. It starts with the immune system's mistaken attack on muscle, causing weakness and fatigue. The cause isn't lifestyle or contagion, it's a mix of genetics and environment. Diagnosis can be tricky, but a combination of exams, blood tests, and muscle biopsy provides answers. Modern treatments can control inflammation and restore strength. Comprehensive management, medication, therapy, lifestyle changes, and support makes a real difference. Don't ignore persistent muscle weakness. Early medical attention is vital. The sooner you act, the better your long-term outcome. With proactive care, people with polymyositis can regain strength and live fulfilling lives. Hope is real. Effective treatment and support are available. Take action early, and you can shape your future with this condition.